Welcome back. This is Rafa, Majo, and Jacqueline. And today we're going to talk about disease prevention. Is it the responsibility of individuals, families, or of the government? With our compare and contrast essays. Let's get started. So the first essay is mine and goes like this. In the present era, we have learned how important disease prevention is in a population as new viruses and health threats continue to arise. We have had medical technological advancements, public health programs, and lifestyle awareness, thanks to the multiple experts that arise in the media and research programs. Although citizens have a shared responsibility of maintaining healthy habits, the government still has the responsibility of providing resources and being the safety net for the citizens. Therefore, the responsibility is shared when the government in order to prevent diseases and innovate our technology. On one hand, families and individuals need to be responsible in their habits to prevent preventable illnesses. Since these come from bad habits often, this includes preventing sedentary lifestyles, bad nutrition, or drug dependency. Actions such as seeking medics in case of symptoms, teaching the kids healthy habits, or teaching health by being a role model are actions that contribute to a population's health. However, external risks can't be avoided just by families themselves. Not all populations have access to healthcare, so local clinics and public hospitals are important. But if these are underfunded, overcrowded, or not being accessible enough, the vulnerable populations might suffer. Therefore, the need to strengthen these programs. On the other hand, governments are capable of using their authority and resources to create big solutions that protect the entire population. From funding specific and scientific research to regulating patents to make more and better treatments, the reinforcement of public institutions is key due to the epidemic prevention they provide through vaccination. Nevertheless, a government cannot contain health issues without citizen cooperation. Hence, it's a shared responsibility of the government and the individuals, regardless of political opinions or personal situations. In conclusion, disease prevention is a responsibility of individuals, families, and the government as a whole. Personal habits help reduce risks, and the government acts as the main support to ensure the services and treatments are applied.
Right, Rafa. Disease prevention is a major issue that affects the well-being of society. Some people think individuals and their families should take the responsibility for staying healthy, while others believe the government must protect citizens with strong public health systems. My thesis statement is that disease prevention should be shared by individuals and government because personal habits help reduce, but government support is necessary to protect people from bigger health problems. Individuals and families play a role because many diseases are preventable through daily habits. A person who lives a sedentary lifestyle has a higher risk. Families can promote good eating and exercise. These actions ease the burden on hospitals. However, even when people try to stay healthy, they can't control threats like an epidemic. The government also has a major responsibility. It must provide a safety net with vaccines, education, and proper treatment. Governments must regulate medicines, especially when a patent makes a drug too expensive or when misuse leads to drug dependency. Offering consultation services can help. Governments often face underfunding, which limits medical services. Despite this, when individuals and governments support them, the population becomes healthier and more productive. Inclusion, regardless of challenges, individuals and governments must work together to prevent disease, even during economic difficulties.
Okay, moving on to my final essay. Okay, here I talk about disease prevention. Disease prevention may seem like it's a responsibility shared between the government and the individuals. Despite this, my thesis statement is that I believe the government carries a much heavier load of responsibility when it comes to disease prevention due to two key factors: information and resources. The government holds resources that allow deeper investigation on how to prevent the diseases, gaining the information necessary to show any ordinary person how to prevent and steer clear of any possible disease. One of the bigger reasons why I believe the government plays a bigger part in this specific issue is vaccination campaigns. Since the vector of control operations and health education initiatives all require massive logistical infrastructure, these are preventative interventions that depend on the government financial support. Private entities usually lack the population-wide reach to provide equitable preventive coverage, making state programs necessary to ensure universal immunization and community protection. Disease prevention includes actions to stop diseases from occurring, minimize their impact, and treat them in early stages. It involves measures like vaccination, lifestyle changes, early screening for detection, and public health initiatives to reduce risks at both individual and community levels. We can argue most of these are the responsibility of an individual, since examples like lifestyle changes and vaccines are an individual's responsibility. But we cannot change that the government has a bigger part in disease prevention than the average individual, due to having teams of scientists and doctors who discover how to minimize impact and even create vaccines to help the community, like said previously. In conclusion, with the previously said information too, I wholeheartedly believe that the individuals do need to take care of themselves with the resources and information given, but at the end of the day, it's the government's responsibility to provide resources to help anyone who can learn and take care for themselves and their families.
Okay, now as for some general differences and similarities, we saw upon the similarities that a common opinion in all essays is the necessary cooperation between the population and the government. Similarly, the three of them highlight the role of the government in public health and the impact it has on the population. Someone? And for the differences, a big difference is, however, the main focus towards the conclusion. My essay focuses more on the population's perspective regarding health and how the government should cooperate with them. Whereas, for example, Jackie's essay, where it focuses more on the government's perspective on why would they cooperate with the civilians to make the health better. And Majo's essay, on the other hand, doubles down on the reason why the government plays a big part in disease prevention. We have, in the same topic, we did notice we had very different essays and different focuses, which I think shows and reflects how we all think, and like we did apply the although and the words to show in contrast. So therefore, we think that the content in this unit is learned. Thank you so much for your attention, and this would be it. Thank you. Crap.
Hace eso para recortar, ¿no? No pasa nada de crap.
¿Qué? No lo recuerdo. No, sí alcancé a decirlo.
Ah, ok, ok. No, es que
Tener